We are joined now by current CDC Director and former Secretary of the North Carolina Department of Health and Human Services, Dr. Mandy Cohen. It is wonderful to see you. Dr. Cohen, in our last interview, you were days away from leaving the role as DHHS Secretary after guiding us through the pandemic. And you told me then, understandably, that you needed a break. Now you're the head of the CDC. What was the call like with the president, and why did you say yes?
Well, it was an honor of a lifetime to lead in North Carolina at such an incredible moment in our history and leading through the COVID crisis. I was so grateful to be able to work for Governor Cooper and work with such an incredible team at the department. But it was a lot. And so I really did need that break. And I spent a lot of time with my family, my husband, my two girls. We went on a bunch of vacations we'd been waiting for. I worked in the private sector, investing in primary care around the country. But when I got a call asking if I would think about coming back, it really was an opportunity to continue the work we were doing in North Carolina, which I was so proud of. And I'm excited to start this new chapter here at the CDC.
You know, in our last interview, you said you thought every single day about how to build trust with the people of North Carolina. Now you're going to have to do that with the entire country. Where do you start?
Yes. Well, luckily, I think we did a terrific job as a team in North Carolina responding to the pandemic. And I think that's because we foundationally focused on that trust. We tried to do three important things. We wanted to be transparent. We wanted to tell folks, what did we know? What did we not know? And what are we working on? Second, we wanted to make sure they saw good execution all the time, right? We did the things we said we would do, and we did them consistently. And then the third is that we built relationships in North Carolina, whether those relationships were with historically marginalized communities or across the aisle. We wanted to build those strong relationships. And luckily, I had the opportunity to build those relationships for several years before the pandemic, and that really helped as we went into a crisis time for our state. So whether that was relationships with our hospital systems or with our communities or at the legislature, all of those were important. So those are the lessons I bring to the CDC, and we're going to be focused on it. And it's what I shared at my very first all hands meeting here at the CDC was about trust. Now we're going to focus on transparency. We're going to focus on execution, and we're focused on building great relationships. Let's
talk about trust, because the Kaiser Family Foundation did some polling, and they found there's really been a steep decline in trust of public health officials in particular, and in the CDC as an institution. So why do you think that is?
Well, one, I want to go back to North Carolina, that we saw that decline in trust happen in other places, but not in North Carolina. And we know it because we measured it. We measured trust over a period of time through the pandemic. And we actually saw trust in the Department of Health and Human Services increase during that time. And again, I think it's because we had a tactical plan to address trust. So I think that there is a way that we can approach that here at the CDC. Those are the lessons I bring. And so I think there is a way that we can focus on trust, focus on making sure that folks can hear simple and clear communications from us. And that's what we're already in the process of working on.
How do you build credibility, though, when misinformation is so widespread? How do you break through that?
Well, for me, the tactic here is flood the zone, meaning that we just need to have good information out there fast. It has to be accurate. It has to be timely so that folks are seeing it where they get their information. And so we have to make sure that we're getting a lot of good information out. And it's also about using trusted messengers. Sometimes that might be me, whether it was in North Carolina or now in this new CDC role. Sometimes I'm the right trusted messenger, but there are tons of good trusted messengers to get out good information. So for me, it's about how do we really make sure that we are getting out fast, accurate, simple information that we can repeat over and over and meet people where they are. So that's what we're going to be focused on. It's what we did in North Carolina. Well, they're going to take that playbook here to CDC.
You say flood the zone. The zone is massive. We're talking
it is.
Social media, TikTok, Instagram, Facebook, and those that false information gets repeated on sites like that. I mean, how do you combat all of that?
Yeah, we have to be where folks are, and that's where folks are consuming their information. And we, CDC, and the scientists that work here and need to get out that good information. So we got to be where folks are. So that'll be on all the social media platforms, whether that's a podcast or in a video or tweeting, whatever it is. I'll do a as you well know, we worked with TikTok influencers, we worked with NASCAR drivers, we worked with faith leaders when we were in North Carolina to get respond to the pandemic. You'll see a similar way that will work here at the CDC, because we have to meet people where they are and where they're consuming their information.
One of the things you said, too, in terms of flooding the zone with accurate information, I remember during the pandemic that so much information was evolving. So, for instance, remember at the beginning of the pandemic when public health officials said masks were not really going to be effective in stopping the spread of COVID. And then it was very clear that it absolutely would potentially stop the spread of COVID, and there were mandates put in place. What would you say the biggest missteps were during the pandemic, specific ones?
So look, folks have asked me for a number of years now to sort of go back. What would you do different? Monday morning quarterback that crisis. And what I would say is like what we were knowing through the crisis changed at different moments. So to look back and say, well, now we know all these things. Shouldn't you have done something different back then? And the answer is, right, we were doing the best we could with the information we had. Mm-hmm. If anything I would change is making sure we're clear about what do we know and what don't we know, and that explaining to folks that things may change over time. And so I'm going to make sure to, bring that lesson learned here to as we're talking about different topics that will evolve over time. We have to understand that we're going to get smarter both about the virus, and things like viruses are going to change, right? So the COVID that happened in 2020 is different in terms of the way COVID is reacting right now. And so we have to help folks understand that when we're making a decision back in 2020, that's not the same as our reality is in 2023. So the virus changes, things will change. And I think that's what's really important. But again, would I do anything different as you go back? No, it was a crisis. We're trying to do the best we can with the information we have, but we just need to be clear about that. What do we know? What do we not know? And what are we working on to get smarter? And how are we working for you every day, the American people, making sure we're protecting you?
I remember you describing some of the decisions you all had to make on things like school lockdowns as gut-wrenching. So what would you say you learned about communicating clearly to the public while working here in North Carolina?
I mean, this pandemic, like I said, was historic. And as a mom of two girls who were in public school, these were incredibly hard decisions, right? We're weighing two very, very important things. We want to protect people's health. We want kids to be in school learning, not just for the learning value, but we knew to get their nutrition, to get their socialization, for their mental health, all the things, right? So those are such hard decisions to say, how do you weigh two things that are both good at the same time? And we had to make some very hard calls, but it's also why we said, we're going to learn as we go. How can we make decisions to get kids back into school as quickly as possible? I was really grateful. My kids, again, public school in Wake County, were back in the classrooms in the fall of 2020 with a lot of hard work from our school districts. It was tough. It was tough on the teachers. It was tough on the parents. So we know we went through a crisis together. What I would say is, right, we've learned a ton about how we can work together going forward. I'm grateful that I'm here to lead the CDC after the pandemic, right? Because that was an incredibly hard time. I think folks did the best job they possibly could in a hard situation. Now I want folks to understand how the CDC will continue to protect your health each and every day with the work that we're doing.
You are really taking on this role during a difficult time for this institution. And I read that you said that your strategy moving forward is going to be accurate, be simple, and be repetitive. I thought about the 3 W's that we all grew to know here in North Carolina. How do you employ that there at the CDC? And also, how do you get morale back on track there at the CDC?
Well, on the 3 W's, right? It was a success when someone would stop me at Target or at Costco and say, "Are you the 3Ws lady?" Because what that meant is that we were saying a simple message, that we were accurate about the science, we were saying a simple message, and we were being repetitive about it so people knew what to do to protect themselves, and we were giving them common sense solutions to do that. And that's what we're bringing here to the CDC. And I think they do a lot of that already. And so for me, that's just going to be an area of focus to make sure that we can have those simple ways for folks to have common sense solutions to protect themselves.
How do you get morale up there?
Well, it starts by being human, right? So I think North Carolina knows I love to talk about my kids and my family. And that's, I think, a way of building bridges. First, I said thank you to this team, right? They've worked very hard in very hard circumstances, trying to respond to this crisis. So I said thank you. I talked about myself and my family and really just trying to build bridges here. And then give us a vision, right, where we're going to go. And part of why folks are here at the CDC is because they are so mission driven, and we can connect to that mission again and again and again every day. So that's how we get morale back.
Dr. Cohen, thank you so much for your time today, and best of luck in this new role.
Thank you, Lena. Great to be with you. Thanks to everyone for their hard work to continue to be healthy in North Carolina. Thanks to my successor, Cody Kinsley, who's doing a terrific job at the department. I'm looking forward to us continuing to work together.
All right. Take care.
Thank you.